Assalamu alaikum. My name is Dr. Anya Humayun, and today our MCQ's topic is primary health care. First MCQ is, a rural community reports high infant mortality despite an increased number of health centers. As a public health officer, what would be the most appropriate first step to assess the effectiveness of the PHC program? Option A, compare the number of health centers with national targets. Option B, evaluate the immunization coverage and maternal care indicators. Option C, conduct a new building inspection survey. Option D, increase the number of doctors. Option E, assess only hospital-based deliveries. The correct answer is option B, evaluate the immunization coverage and maternal care indicators. Next question is, during an assessment of a PHC center, you find well-equipped facilities but poor utilization by the community. Which one is the most likely reason for poor service uptake? Option E, lack of tertiary care linkage. Option B, absence of community participation. Option C, overstaffing of health personnel. Option D, availability of high-cost technology. Option E, poor urban planning. The correct answer is option B, absence of community participation. Next question is, a district health officer wants to evaluate the process indicators of PHC. Which one of the following would best represent this? Option A, percentage of immunization coverage achieved. Option B, maternal mortality ratio. Option C, availability and maintenance of the cold chain equipment. Option D, per capita income. Option E, literacy rate. The correct answer is option C, availability and maintenance of cold chain equipment. Next question is, a PHC program is introduced in a community that uses locally made water filters instead of expensive imported systems. This is an example of which one of the following PHC principle being applied. Option A, equity. Option B, intersectoral coordination. Option C, appropriate technology. Option D, community participation. Option E, decentralization. The correct answer is option C, appropriate technology. Next question is, while assessing PHC services, the officer notes that all villages have access to basic health workers, but urban areas have more doctors per population. Which one of the following aspect of PHC is lacking here? Option A, efficiency. Option B, equity. Option C, effectiveness. Option D, accessibility. And option E is sustainability. The correct answer is equity, option B. Next question is, a new program integrates school health education, safe water supply, and immunization activities. This approach highlights which core principle of PHC? Option A, equity. Option B, intersectoral coordination. Option C, appropriate technology. Option D, community participation. Option E, centralization. The correct answer is option B, intersectoral coordination. Next question is, you are tasked to monitor PHC progress in a district. Which one of the following would best reflect impact indicators? Option A, number of training sessions for health workers. Option B, percentage of pregnant women receiving antenatal care. Option C, decrease in infant mortality rate. Option D, number of outreach clinics established. Option E, immunization session frequency. The correct answer is option C, decrease in infant mortality rate. Next question is, a local health center plans to involve community volunteers in organizing nutrition education sessions. This strategy mainly focuses on improving option A, health financing. Option B, efficiency of tertiary care. Option C, community ownership and sustainability. Option D, technical capacity of staff. And option E, disease surveillance. The correct answer is option C, community ownership and sustainability. Next question is, a health officer is comparing PHC service data between districts. One district has similar input resources but shows poor health outcomes. Which one of the following would be the most appropriate interpretation? Option A, inadequate financial resources. Option B, poor implementation and monitoring of PHC activities. Option C, population differences in genetics. Option D, over-reliance on hospital services. Option E, lack of international aid. The correct answer is option B, poor implementation and monitoring of PHC activities. Question number 10. A new evaluation method is introduced to measure community satisfaction, equity, and quality of services under PHC. This represents which one of the following level of assessment? Option A, structural assessment. Option B, process assessment. Option C, outcome or impact assessment. Option D, epidemiological surveillance. And option E, operational assessment. The correct answer is option C, outcome or impact assessment. Thank you so much.